Hi. Hi, everyone. Hi. Well, I want to welcome you to this week's group visit. Um, we're going to be continuing a conversation I started, I guess, about last month or so ago about intestinal permeability, or leaky gut. It's a really important topic in functional medicine, and it's important that we really lay this as a foundation to everything we do. And I really want you all to kind of understand why we go about the things we do, and or the importance, or just kind of how we go about this. So I am Mary Scalf. I'm a physician assistant here. I may even be your physician assistant here. So just to bring up a few housekeeping reminders, if the Zoom kind of goes out, give us maybe about 10 minutes. May take less time, but to get back up and running, we'll be going as soon as we can. Also, if you have any questions, put them in the chat box. I will address them at the end of this discussion. So restoring the gut, understanding the 5 R's to healing leaky gut. So I want to recap what we discussed last time and leaky gut and why that matters. And so it's important to know that all disease begins in the gut. Hippocrates is the kind of founder of modern medicine, and I don't know why conventional medicine doesn't follow this. So kind of this is a good depiction of what leaky gut is. Kind of the more proper term is going to be intestinal permeability. So normally what we want to see is these intestinal epithelial cells really close and tight together. These cells are going to be very selective as far as what they're going to allow through, either nutrients that kind of pass through the gut after you kind of break down the food that you consume, or liquids. They can go kind of between these cells. This is going to be highly selective. Or if kind of right, they can go through the cells. And then they can get to the bloodstream. And the bloodstream can help get these nutrients to the organs and tissues that it needs to promote and produce health and keep you going well. What happens in leaky gut, whether it's due to stress, alcohol, antibiotic use, non-steroidal anti-inflammatory medications, proton pump inhibitors like acid reducers, food allergens, infections, toxins, etc., we can get leaky gut. And you'll see where those junctions between those epithelial cells then widen. Or things that are pathogens or food particles are now able, aside from foods, they're now able to get through the cells, between them or through them. And then we get things into our bloodstream that we don't want. And so on the other side here starts our immune system reaction. And so that can start to create inflammation. And inflammation can kind of go systemically. It can go to our brains. And then we've really got a problem. So kind of the problem at hand, and why we want to solve this, is that this is going to be linked to so many of our health conditions and concerns. So things like autoimmune diseases, getting Hashimoto's, rheumatoid arthritis, psoriasis, and many, many more, inflammatory bowel disease, osteoarthritis, hives, eczema, other rashes, think, I already said psoriasis, think acne, environmental allergies, food allergies, of course, acne, mood disorders, anxiety, depression, even links to schizophrenia, chronic fatigue issues, autism, dementia, obesity. If you're having trouble losing weight, your gut weight may be the issue. And then, of course, some things that are more obvious, things like IBS, irritable bowel syndrome. This picture kind of cracks me up because whenever I try to explain leaky gut to my patients, I like to say it's not that you have these fluids spewing out of your intestines into your body cavity and so on and so forth. But so this is your not actual leaky gut depiction. So that's kind of my really brief recap. But I like to think about gut healing. And I want you to think about what you have heard before maybe coming to MaxWell Clinic or from the media or bloggers, etc., about what you know about gut healing. So before I came to MaxWell, I thought gut healing was like drink kombucha. They've got good bacteria in that vinegary fermented substance. It's really good for your health. So I started drinking kombucha. Little did I know, some of those kombuchas have a lot more sugar, which is actually not good for your gut health. I thought this was kefir or kefir. Kefir is a fermented kind of dairy beverage. Again, probiotics are the theme here. Probiotics in general. So there are so many probiotics on the market, but I would encourage you to use these judiciously, meaning that probiotic may not be right for everyone, and higher doses of probiotics especially may not be right for a particular individual. You're probably going to be safe with a lower dose probiotic, think something about 30 billion CFUs, but otherwise you may run into some problems, especially if you have something called small intestinal bowel overgrowth. It can actually make your symptoms of like abdominal pain, bloating worse. So just because they say probiotics are good doesn't mean they're right for you. Being gluten-free. I think in the last maybe 5-10 years, we have seen this explosion of gluten-free products and items. It's become almost more like a marketing term. And then people have begun to assess or to identify gluten-free as healthy. Well, everything gluten-free is not necessarily healthy. A lot of gluten-free items are still heavily processed foods and can still cause inflammation in the bodies. And then bone broth. Bone broth is actually really beneficial to our gut health, but that was something that I remember and trying to get on board with as well. So what actually is gut healing? It's the 5R framework. So I want to start to dig into that now. So the 5R framework is very foundational for functional medicine practitioners. And it's something that we are all taught as we become certified in this type of medicine. So because a functioning digestive system is so essential to good health. And you're gonna these issues can cause more than just kind of your gastrointestinal complaints. You might not just have bloating, gas, diarrhea. Like I said earlier, it's going to underlie your chronic health conditions that I mentioned earlier. So there's so much that can go wrong in our gut. And so if you think about our gut is a tube running from our mouth to our anus. And it is where the outside environment intersects with our body. So we want to keep that health intact, or else that leakiness, like I kind of showed in that picture earlier, is going to wreak havoc in our bodies. So what are the 5 R's in functional medicine? Here is the 5R approach. So we want to remove. What do we want to remove? We want to remove stressors. What are those stressors? It's not necessarily going to be things like mental, emotional, physical stressors, though, that will kind of play into this as well. We want to think about stressors that negatively affect the environment of our gastrointestinal tract. And these could be food sensitivities or allergies. And this is why we recommend quite a few of our patients to go through an elimination diet. That will get rid of the most inflammatory foods that are likely keeping that cycle of leaky gut going. And by removing those foods, the gut has time to heal. By decreasing that overall inflammatory load, while the foods themselves may not be the reason of leaky gut, it's definitely not doing us any favors. The immune system is always reacting to these foods that now the immune system can see because of that gut leakiness. Also, part of those food sensitivities are going to be part of the pretty ubiquitous in the standard American diet. So that's where gluten-free actually may help a lot of people to decrease inflammation in the body. But also corn, dairy, soy, peanuts, processed sugars, egg, those all may cause an issue. So also think about bacteria, think about parasites, think about yeast. So at some point or other in your journey at MaxWell Clinic, you have done or you are likely to do a stool test. It's probably one of the favorite things that our patients do. Not really. I have some that ask me not to do it again. So it gives us so much important information, though, about how to best help you. How I mentioned probiotics earlier. These stool tests will tell us kind of what your gut needs, and by the amount of bacteria we see with beneficial probiotics, we're able actually to recommend the right probiotic for you to aid in building your health. If you have bad bacteria in your gut, that's going to continue that inflammatory issue and that gut leakiness. So we'll have to use some kind of protocol using herbals, or maybe even, depending on your symptoms, an antibiotic. Parasites, they do happen. Not everybody has them, but the stool test that we recommend gets 3 stool samples. Those parasites are sneaky and they like to hide, and by doing 3 samples, we can usually catch that. Sometimes they are really difficult to get rid of, but they do help to get rid of them for your health. Yeast overgrowth. We have yeast that inhabit our guts, not normally, but if we have that imbalance of bacteria in our gut, that can lead to a yeast overgrowth. And that's why many people, after you take an antibiotic, women especially, might get a yeast infection. Yeast also can kind of show up on your skin and show up kind of in your mouth and on your tongue, and show up kind of and under skin folds and kind of your private areas. So that could also signal a yeast overgrowth in your intestines. So again, we might use some natural antifungals or anti-yeast medications and dietary interventions to help balance that yeast. Our hope, though, with removing foods is not to have you have to remove them forever, though you may notice that you feel best if you continue to remove gluten or dairy from your diet, or whatever you find that you react to after an elimination diet. We want to replace. What do we want to replace? Well, we want to replace those digestive secretions. And what are those digestive secretions? Well, just like in the name, you think of them as your digestive enzymes. Digestion really begins in your mouth. You have this mechanical digestion with this fun word called mastication. This is where you'll start to get some of that chemical breakdown with salivary kind of amylase to start breaking that food down. As you kind of go into the stomach, you're going to have gastric acid that we want to replace, hydrochloric acid. Some issues with heartburn and reflux actually are because of low stomach acid and not too much stomach acid. So when you have those symptoms and you get prescribed something like Nexium or Pepcid, or actually reducing acid more, may actually continue to cause issues. We may need to replace hydrochloric acid. We may need to replace things like amylase, lipase, protease that come from your pancreas that help to break down proteins, fats, and carbs. We also want to think about replacing bile acids. If you don't have a gallbladder, you might have trouble digesting fats. If you have insufficient action from your gallbladder, you may have trouble digesting fats. If you notice that your stool is really greasy and you have to wipe a lot, well, you might have trouble digesting fats. So using enzymes like ox bile can help kind of replace that and help improve that. If we're not digesting our foods well, then we won't be able to, again, get all the goodness from our foods when you go through all that trouble to change your diet and eat better. So medications, aging are also going to change kind of how much of those enzymes we secrete or our ability to do so. The third R, reinoculate. What do we reinoculate? Well, we want to reinoculate prebiotics and we want to reinoculate with probiotics. Probiotics are a good bacteria. When we have enough of those good bacteria, the beneficial ones mostly being, our favorites are Lactobacillus and Bifidobacterium, they help to keep the pH in the gut low. They help to ward off or kill off any bad bacteria from overgrowing. So if you have insufficient amounts of that, that can cause that dysbiosis, the imbalance of bacteria in your gut. So you are going to find probiotics in supplements as well as foods. So we want to help, I always want to encourage nutrition over taking things if we can. But sometimes to make a big intervention, we need those concentrated doses of probiotics or of certain minerals and nutrients in order to help get you better faster. So, but fermented foods, think about sauerkraut, kimchi, yogurt, miso, tempeh can be very beneficial for probiotic health. So prebiotics, I want you to think about prebiotics to be like the food for your probiotics. They help to stimulate the growth of those beneficial bacteria. If you're taking a probiotic, those prebiotics convince those probiotics that you're taking to stay and move into your gut. So prebiotics are going to be coming from fiber. That fiber is going to be called inulin. You're going to get that from artichokes, from garlic, leeks, onion, chicory, tofu, and other soy products. Don't recommend soy products if you have a sensitivity to soy, though. It's also going to be in grains. Again, are you sensitive to any type of grains? And make sure they're gluten-free, but barley, flax, and oats. Wheat, not gluten-free, but it's a good prebiotic inulin source. What happens when we have that right balance? Again, it helps to keep the pH in the gut low, keeps bacteria from overgrowing, protects you from any, if you have to take an antibiotic side effects. We want to repair your gut as well. How do we do that? So we're going to repair that GI lining. We want to help tighten those epithelial cells from being so leaky. How we do that, we're going to use antioxidants. We're going to use fish oil. We're going to use zinc. Those antioxidants we're going to use are like vitamin C, vitamin A, vitamin E, fiber. So fiber is going to be food for those probiotics. Probiotics love fiber. They chomp down on that fiber, and when they do, they start to make these short-chain fatty acids, which help to repair that gut lining as well. L-glutamine is an amino acid that helps to heal and seal the gut. So again, we're trying to bring those cells back to their healthy status. Something I want to mention too is using 5-HTP. So, um, 5-HTP, I wish I had that picture of those gut cells again. But if you notice in those gut cells, on the tips of them, they have these microvilli, these little finger-like projections that help to increase the surface area. So what happens when we have that leaky gut, depending on how bad it is, then those microvilli can get worn down. And what we lose when those microvilli get worn down is something called DAO, diamine oxidase, and that helps us to deal with histamines in the body and break them down. And so if you lack that DAO, you may have a lot of allergic type symptoms. So if those are denuded, we have to try to grow those again to help get your gut health back together. And one thing that helps with that, besides just supplementing with that DAO enzyme or SAMe, is going to be 5-HTP. So 5-HTP, aside from being a precursor to the neurotransmitters, serotonin and melatonin in the body that help to support your mood and sleep, they're also going to help grow those intestinal microvilli. I think that's really fascinating. Also, because your gut actually is responsible for about 70% of those neurotransmitters. So if you're having problems with like depression, anxiety, I hope you're starting to see that link of kind of why that gut health matters. And then the last star is rebalance. I know, hope you didn't think you're going to get away without some lifestyle recommendations. So, rebalance. What do we want to rebalance? We want to make sure we have enough sleep. Inadequate sleep can affect our GI tract. We want to exercise. We don't want to exercise too little. We don't want to exercise too much. Too much exercise can be a stressor on our bodies and can perpetuate inflammation. So we have to kind of figure out what is right for you. Also need to manage stress well. Dr. Woods did a really good group visit a couple weeks ago on breathing. And it's one of the more difficult recommendations that we prescribe for people to follow. It takes a lot of discipline, but it can have the biggest impact. Because what we are trying to do is send a signal to your brain to relax. If we have that fight or flight mechanism always on, the body is not prioritizing healing. It's just prioritizing survival. So you're not going to be in thriving mode. You're going to be in solely survival mode. So it's going to further impair digestion. So even if you're like, man, I'm eating really well, but I still feel like crap. But if you're over-exercising, you're not prioritizing sleep, you're not taking moments to relax, then that's your problem. So those are our 5 R's. So I'd like to know if you have any questions. I'm going to try to go ahead and answer one for you. So a question I get all the time is, how long does gut healing take? And that depends. We practice personalized systems medicine, and how long this takes kind of depends on where you're at, because a lot of times you're not going to get into a state of unhealth overnight. So that can almost take about as much time as it took you to get unwell. But I would have set an expectation for somewhere, I would say, try to look at least 6 months to a year. And that, again, is going to vary from person to person, depending on your history and your needs, and what your environment's like, and what medications you're already on. So I will see people that are relatively young and healthy and not a lot of issues. I see them get better. They do an elimination diet. We replenish omega-3 fatty acids, iron, vitamin D. And after like a couple of months, amazing. They're feeling great. Others, takes a lot more time. So, but some patients may see benefit in 3 months, some 6, some a year, but again, depends on all the issues that are kind of found. So, well, I do hope this has been really helpful um, about our approach to gut healing and hopefully hope you understand why we've recommended some of the things we do in order to get you well. So even though I listed those 5 R's in a particular order, some of those mechanisms are going to happen all at once, or maybe they'll be gradually layered on. We always want to tailor what we do to you. I never want anyone to feel overwhelmed with what we're doing, but also how much we're able to do at a time may give us more robust results in healing. And so the expectation needs to be, depending on what we're doing, it might just take more time. I appreciate that expression of thankfulness. Thank you for that. So, any other questions? I would love to help you understand anything about this topic more. So I'm gonna leave this just for maybe another minute. I really appreciate you spending Friday afternoon with me. If you would like to explore any of these options, I encourage you to reach out to your MaxWell clinician. We are very passionate about this topic. So I would say if you find yourself not getting better and it's been a while since we've looked at your gut, I would recommend a reassessment. Sometimes we need a reset. I think after the first of the year is a great time to reset with an elimination diet. See what you notice that you might have forgotten. I also want you to pay attention to, this is a really awkward question that I ask patients that matters. So, what's your stool like? We ask everybody if you have a bowel movement daily, and growing up, I never paid attention to it, and I realized as I get older just how important it is. And kind of the traditional teaching is that you just go as much as you need to go. So regular for some was believed to be if you go every 3 days, then you go every 3 days. But honestly, if you're eating food, you should be eliminating daily. So ideally, if you look at a Bristol stool chart, it has a gradient of what stool should look like. So the basics though, as you know, is your stool, is it looking like pebbles? Is it looking like logs? Is it looking like a snake? Is it looking like pudding? Or is it looking like tea? The ideal stool is going to look like a snake. If you're looking kind of more like logs, you might need more hydration or more fiber. Yeah, pebbles, that's more constipation. May need some magnesium citrate, fiber, water, maybe a probiotic. If you're having loose stool, pudding, tea, again, we think about maybe you need digestive enzymes or bile acids. Your gut has your enteric nervous system. And so if you are kind of an anxious and nervous person, then kind of again, not taking that time to de-stress, that's going to upregulate that sympathetic, that fight or flight. You're going to have quicker evacuation of your stool. So your body does not prioritize breaking down foods into their nutrients and micronutrients, and it's just fast evacuation. Also, that could be an infection as well. So there's so much we can learn about our poop. So So even if you don't have any digestive symptoms, issues could still be coming from your gut. And there's much we can do and look into to help improve that. So, well, once again, I appreciate your time, and I hope this has been very informative and hopefully interesting. Have a great weekend, everyone.